Lots of conflicts of interest. I'm here on behalf of Obesity Solutions. We're interested in taking beautiful science and scaling it out into the public domain. Build, test, scale. The issue with sedentary behavior is, look, it's really quite interesting, isn't it, if you think about it, that you've got a room of 106 scientific leaders who've heard 3 hours of argument with respect to the ills of physical activity, yet until Jim spoke, we were all sitting. I mean, it's an extraordinary thing. Think how difficult this is going to be in the public domain to really get the world up and moving. The literature is shown here. On the x-axis is PubMed citations. On the y-axis is number. I mean, the issue, it's real. Inactivity affects every organ system, diabetes, hypertension, cardiovascular disease, cancer, low mood, depression prevention. It's everything. The interesting thing, however, about the interface between inactivity and obesity is that obesity, not only are we able to operate from the foundation of hypothesis-driven research shown in the triangles, hypothesis tested, we re-educate our foundation, our scientific foundation. But what's really interesting and powerful about this group of people in this room today and the need for what we do in the public domain, just read the Wall Street Journal today, is that obesity affects every organ system, but also my patients feel victimized 5 times every hour. This is a personal struggle for, 100 million people in the United States alone. And we have the opportunity as a scientific community to impact both policy, product, and philosophy, the philosophy of how we live. So what Jim asked me to talk about today was some of the bridges that we've been making as part of a team with respect to bringing this amazing science that you've heard about all morning into reality. How do you actually get people moving? Our first challenge was technology. Pedometers are sort of super in that if you get on a treadmill and really pound away, they'll count your steps. This was one given out for free by a food company, McDonald's, you may have heard of. They gave away so many of these pedometers that the plastic, the hard coat plastic used in Taiwan to make them, ran out. However, when you actually bring these into the lab and validate them, here you see walking speed at miles per hour on the x-axis and percent error on the y-axis. The average median free living walking velocity is 1.1 mile an hour when you actually average everything out. What you see is error rates of 100%. I mean, that's extraordinary, right? You might as well look at the pedometer and guess rather than. On the other hand, we can't go around the United States, and trust me, we've tried, and put everybody in magic underwear. Of course, coming from the Mayo Clinic, these are underwear shown as overwear, and they sense all the movements a person does. But again, this type of technology is $7,000 a unit. That's not plausible either. Really, the revolutionary breakthrough, and it's a profound and important technology, is the MEMS, micro-electromechanical systems. And the way they work, the MEMS chip works, is these are interdigitating teeth. Try and say that when you're jet lagged. And they function like this. They move like this. And the capacitance across those two moving plates is a measure of the amount of movement. That's how the accelerometer that's been mentioned already by several of the speakers works. What's really, really cool about the latest grade of MEMS Tri-Axial Accelerometers is not only do you have moving interdigital plates, but across the top of the plates, you have laser beam. This is all inside a silicon chip. Not only that, the next generation of MEMS Tri-Axial Accelerometers not only have all of that stuff inside a little tiny chip, but also are going to be intelligent. We're going to be able to tell them to pick up different things. So this technology, even though it's becoming commonplace, is in its infancy. We exploited it in numerous ways. One of them was to immediately take it and put it into earpieces when earpieces were cool. I learned this Christmas that earpieces are no longer cool. $300 earphones are cool. And so you can understand why that really never garnished any acceleration in the marketplace. We worked with Apple, who then worked with Nike, to integrate this type of technology into a little pea that goes inside gym shoes. It was extremely effective collaboration. We worked with the US Army to build the piece, the blue piece box in the middle. This is a beautiful, beautiful piece of circuitry. 5 circuit boards all mulched together, and all the wires, so to speak, you know, weave around and talk to each other. Beautiful, beautiful, beautiful technology. Took us 2.5 years to develop with Barry Gilbert in our special microprocessor lab. NIH insisted that we try these out on 9-year-old children in Washington. We didn't get a single unit back working. The innovation is the current term used by children to destroy technology was just mind-boggling. They put them in washing machines, threw them out of windows. We had one boy, put his device under a chair leg and jump up and down on it just to see how many jumps it would take to break it. But it taught us a lot about robustness and technology, and also the need to collaborate with industrial collaborators to move this along quickly. Next to it, it was also something that died very quickly. It's a Trio cell phone. For many of you in this room, you may remember it, but it's an antique to most of the people I work with. And what we did is we connected it to an accelerometer unit so that we could use the cell phone network. What you see in the top right is the avatar. It's actually my avatar, and not surprisingly, it looks a little bit like Arnold Schwarzenegger. And if that's my mum, tell her I'll definitely call her later. The idea here is that as I'm moving around during the day, my avatar, Arnold, if you like, lots and lots of circles, and I can compete physical activity-wise with adults and children, so to speak, right around the world with respect to physical activity. The trouble is the Trio cell phone died, and there became a better way of doing this. We built a self-contained device that allows individuals to measure their own physical activity, having learned from the disastrous experience with the 5-circuit board army system that we developed that was killed by those kids in Washington. I still haven't forgiven them, by the way. We had a focus group afterwards, and the smiles on the faces of these children as they explained how they broke our technology is just beautiful. Really important, however, is this, I believe. This is the same chip I've just been showing you. It's made by Kionics. And it's sitting next to the motherboard inside. This is a G3 cell phone. If any of you got an Apple V cell phone, you can bring it up to me later. I'll actually hack into the back of the casing and show you where the Tri-Axial Accelerometer is. It's also, by the way, present in the other platform. What's that one called? Android platform, that's the one. And the reason it's there is that when you rotate the screen, what the Tri-Axial Accelerometer is doing is measuring Earth's gravitational field. That's how it knows how to rotate the screen. But for us, it obviously creates all of a sudden a huge opportunity to be measuring non-exercise activity, general activity levels, a technological opportunity. However, as was mentioned, I think in one of the questions, obesity, inactivity, sedentariness isn't just about measuring the calories you burn, the amount of movement you do. There are other aspects too. Sleep is one of them. Stress is another. This is a little camera, again, we developed in collaboration with the University of Houston. This was a publication in Work. There was one in Nature too. And what it does is it measures, using high-definition thermal imaging, the blood vessels and the muscle contractions across the face. And what it allows us to do is see how stressed out people are. And we deployed these in one US corporation in a pilot study, and we found out that people, and this will actually shock you, are stressed out all the time. And so we're not quite sure what to sort of do with the information now that we can gather it. But the technology exists to start measuring some of the other variables too. However, technology isn't just about chips and electric. This is a group of community health workers I had the pleasure of working with in Kinshasa. These individuals are members of the public who've been specifically trained to go out into communities of individuals who've been isolated with SIDA, which is the French sort of equivalent of the word AIDS. These individuals are completely ostracized by society and live together in little groups of people who are self-sufficient. It's an extraordinary model. These individuals, through Global Health Fund, take out to these people the medications for AIDS and like antibiotic prophylaxis and so on and so on and so forth. But the point is, here is a technology that doesn't involve any electronics. It's the ability to scale the delivery system, community health workers in this case. How do we take these kind of approaches and bring them into a corporate environment? This was again raised earlier in the questions. Well, we started doing this kind of work in the corporate environment specifically for this reason. If you go to a board of management at a big US corporation and say, look, somebody with obesity with multiple metabolic risk factors is costing your company. Most companies, of course, are self-insured or have a direct game to play in the rate of change of the insurance premiums per capita. What you realize, and these are old data, is that somebody with obesity and multiple risk factors is costing a corporation $7,000 per person per year more. Therefore, there's a real value to be gained because, of course, if you can prevent one person from converting from pre-diabetes to diabetes, you're saving that company specifically $10,000 per year per individual. And so that kind of language resonates very well in corporate boardrooms. We got very interested in the Office of the Future, and I think now many years ago, this is in 2005, and these original treadmill desks were designed in Schiphol Airport in collaboration with a German design team who met me in Schiphol Airport. And really what we did is a concept office where you can see the space is open, there's a walking track in the background, there are chairs, but they're right at the back. And really you're either on an exercise bike or a treadmill. We tested this out in 304 people specifically to ascertain not whether they burnt more calories, not whether they moved, but whether productivity declines, and it didn't. And as soon as we had that data, we could try and move forwards. Again, this is something our team, I've learned over the last, my goodness, I hate to tell you, Jim, 25 years, over the last few years. And it's that you can design stuff in the lab and you can test it, and you can validate it and even publish it. But to get it out, you have to have a corporate partner. You have to have somebody who knows all the rules, tricks, and regulations on how to move this stuff into real offices. There are lots of rules and regulations. You can't have a 6-mile-an-hour treadmill in the office for obvious reasons. So these treadmills are actually made by, it's all built in the United States. I have no conflict of interest anymore, by the way. I did at the original partnership in 2005. But the whole idea is that this fits into a traditional cube space. They don't drain a lot of power, and the treadmill maxes out at 3 miles an hour. Yeah, they cost $4,000. You know, but it's like the first video recorder. That also cost $4,000, and now you can't give them away. This is now the Trek desk. It's available, I think, for $470. This year, Walmart and Target have brought out models that are, again, very, very cost effective. They've been deployed across multiple offices. And you don't need to have treadmill desks. You don't need to have treadmill desks. You do not need to have treadmill desks. You don't need treadmill desks. What you need is corporate leadership, which includes the whole scale, all the way down from the janitorial staff, all the way up to the CEO, that believe that this is critically important to the effectiveness of the workforce. These are little stepper devices that lives underneath a secretarial desk or a standard desk, and when the phone goes, they're pulled out and you start stepping away. We've incorporated the electronics into them so you can get a printout at the end of your day as to how many hours, my goodness, this is going to cost me a fortune. Anyway, how many hours an individual is stepping and talking on the phone. You don't even need those. We've worked in 65 corporations in the United States. We've worked in some others in different places. Walk and talk meetings are universally effective. You have a little, you wear these lanyards, and you have a sort of a policy saying if somebody's doing a walk and talk meeting, you don't interrupt. Basically, that's simple, and don't eavesdrop. Although many US corporations, by the way, have big policies about everyone should eavesdrop because we're all very transparent now. I mean, I'm not transparent, you're not transparent, but US corporations are transparent. Suffice it to say, walk and talk meetings are effective, the meetings last less time, and no one falls asleep. We take all of these ideas and bring them back into the lab, we validate them, we publish them, and the reason that's important is, again, when we go out into corporate offices, we're now bringing about 74 peer-reviewed publications explaining these different elements and how they actually fit in. Bringing it all together, however, isn't the same thing as doing the pieces. And what we found is that the lady, her name is actually Desiree, so we have a trainer-trainer module who deliver these programs. We work with the IT people in the company, work with the lawyers, work with the accountants, work with the healthcare, delivery access. You have to work with all of these people, and the lawyers, I mentioned them twice, right? You have to work with all of these people to deliver these programs, otherwise they fail. Otherwise somebody says, you can't do that for X, Y, and Z reasons. We integrate the technology, we integrate the devices. You don't need treadmill desks, you can have lanyards. Whatever the person, whatever the corporation needs, we can deliver. This is an example. The important thing about, the rather odd-looking bar chart is actually a representation of a year and a half of physical activity data for a work unit for a work unit with data gathered every minute for a year. And the point being is it's just one of the ways of representing very, very complex data sets to corporate management. You can see who's in the program, who isn't in the program, darker lines mean more activity. And so we've had to address how do you actually represent very, very large data sets to corporate management. Importantly, you can see the treadmill desk thing, but importantly, the chap in the white shirt is actually a manager who's a sales manager, and the lady in blue doing, this thing? Stone, rock, scissors. Yeah, she's doing that. She's actually a client of the company who's there to buy business. And it's very interesting that I noticed that they're actually doing business over rock, paper, scissors. You get the contract, rock, paper, scissors, you've lost it. But you get but the people who come into this company, this is a financial services company, are electrified by the fact that the whole thing is dynamic. Their business, their productivity has increased. They had their record quarter at the time we were doing this. All of these programs, all of these corporate programs, we do validation studies. I think somebody asked earlier, this is, body fat decreases, lean mass increases. We just completed a 2-year prospective randomized trial in quite a large US corporation. That's going to be published in Obesity. It's coming, to a magazine near you soon. The interesting thing, however, is I haven't found a single, and perhaps I stand to be corrected, I haven't seen a single prospective randomized trial on introducing the chair. Yet the standards for introducing change, active work, are far greater. We're willing to meet them, but that's what it takes. So we go into corporations, we take all of these scaled ideas, and we provide a consulting document to the given corporation, depending on what their spend is, depending on what their give is, and we deploy these various offerings. We work currently in 67 US corporations, just had another 2. What's very interesting, and really what's the driver, because you can talk about health, but you've got to remember for a company, they're looking at Q1, 2, 3, and they're often looking at Q1, 2 return, quarter 1, 2 returns. So you can talk about 2-year outcomes in health, even 1-year outcomes in health. On percent of people prevented with diabetes, it tends to be we have about a 60% prevention. So if somebody has pre-diabetes, we can prevent about 60% of those people converting to diabetes. Those aren't really the things that really hit in corporate boardrooms, is productivity. And we've shown that there's never a decrement in productivity, and on average, it's about a 5 or 6, depending how you measure it, increase in productivity. And the biggest thing is we also are able now to impact, again, because we've published all of this data, the rate of increase in healthcare insurance premiums per individual. So we can actually impact how much insurance increases, obviously to the benefit of these companies. The Healthcare Reform Act has enormous, enormous opportunity and space for delivering all sorts of nutrition, activity programs into corporate workplaces, particularly small and medium-sized companies. So there are phenomenal opportunities to be bringing these programs out. How do you scale that model of the community health workers? We've also been very interested in utilizing the Healthcare Reform Act as a means of deploying high-efficiency, low-cost medicine. And so we've started training community health workers to go across and work in the medical model, this time using the axis of diabetes, hypertension, cardiovascular disease prevention, medication cost prevention, physician visit prevention as the financial model, to go out and deliver community health worker training to individuals to prevent healthcare costs increases. And we've done this is a program we initiated right across Cleveland. And what we do is we package all the medical supplies into crates, much like Doctors Without Borders, who are totally the inspiration for this. And we can deliver that now in inner city environments. We're doing the same in Phoenix. Well, it's great to do corporations. We got heavily slammed. How about the kids? Well, it was actually important to have done the corporations kind of first, because we had a development team in place, we had infrastructure, we had finances, we had availability. And the first thing we did is we said to kids, age about 11 to 12, what would be your dream school to promote physical activity, non-exercise activity, active learning? They came up with what looks like a village, Socratic learning. The kids came up with this themselves, totally cool. They designed all the bits and pieces. They designed the classroom in Minnesota. It happened to be a hockey arena. Jim was almost going to come for the opening, but he got stopped by not a sandstorm, but a snowstorm. Do you remember that day? And Jim was a big part of helping us do this. Very interestingly, kids like to work in hockey arenas, the whiteboards they design themselves. This girl is standing in front of a desk she designed herself. She has a design patent on it, and it was actually delivered to KI, which is a big school furniture manufacturing company. Again, we took the technology, we validated the approach, and the red shows that if you allow kids to move whilst in education, they will double their daily physical activity. Well, you can't go around building $300,000 schools every day. We would like to, and in fact, in Germany, 10% of all new schools are now active schools, health schools, and that same bill is going to pass, and we're going to do the same in Sweden. So 10% of all new schools are built every year. That's going to be the same in Sweden too. But nonetheless, you can't rebuild every single school in America yet, of course. So we've been very interested in how you take these ideas and scale them. This is a kit. It costs less than $500. It's been approved by all the various sort of safety people and the Parent Teachers Association. It's in a standard classroom, obviously emptied of desks. Kids go in there and they learn mathematics, English, all sorts of things. And physical activity increases, not only interestingly while they're in the classroom, because it's one classroom and the kids rotate through it depending on what class they're in, but not only do they increase their physical activity during the class, but after that too. It lasts about, the effect is 2 days, so therefore every other day we get the kids back in there, only for half an hour, but they're active all day long, and of course the school becomes very permissive of activity. And you might say, well, oh, that's great, 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 but school's still, how are you actually going to do it? Well, this is very, very interesting. The lady in front of you with her permission is standing in front of her son with her permission. She designed a whole active classroom herself. She's a parent-led, and we facilitated her with presentations, with publications. She raised the funds locally, and she got her whole classroom. We published this as well. And that whole classroom of kids at standing desk learning. Again, this is a program in Milan where this is actually very, very interesting. Are we okay for time, Jim? Are we okay? This clock is static. Are we okay for time? Oh, I better move. This is a very interesting program with Milan where the bus drivers, instead of driving on good days, walk kids to school. Bouncy balls, somebody asked the question. Amazed, I'm actually not a great fan of bouncy balls, but I tell you, in all the classroom programs that have deployed them, because they only cost about $14 a unit, or less in fact now, they're actually very, very effective and positive feedback from teachers and kids and everything. It's very interesting, so I stand corrected. But the important thing is productivity. Productivity just like in workplace. Educational improvement is better than actually for people working in American corporations. Kids learn about 10 to 20% better. That data has been verified across multiple US schools and right across the German program. So kids learn better when they're moving, like we needed to be told that. We've been perplexed as to how you can keep bringing science out into schools. You can't get kids to come onto the research centers. So we developed a mobile laboratory. It has a DEXA machine, satellites, HIPAA-approved records, everything you could possibly dream of, better than our actually lab in Rochester, and it's all on the road. We've got 2 of these and we're building our 3rd. And what we're trying to do now in Phoenix is take all of this and kind of do like we did in the corporations, is integrate this with a mentoring of teachers to deliver the health programs, mentoring of kids to have kid champions, but integrating it with the medical system using community health workers and Medicaid. So this is a program we're delivering across 10 schools in Phoenix. Great to do companies, great to do schools. How about us? How about individuals? Well, we had all these corporate plans sort of sitting around. We tested them, we used them, published them, made the book, then the movie. Then the device became individual, as you got your own individual program. This I'm going to point out very, very quickly. Do you remember I mentioned that inside all of our cell phones is the Tri-Axial Accelerometer? We validated it in the lab. We got the best validation data we've ever had. Beautiful tracks, because there's a lot of frequency modulation by the cell phone manufacturers on the motherboard. Then we deployed an app with no funding, nothing. We just put it out on the internet. After 4 months, we have 7,500 users. Then Business Week named it one of their top 5 apps. And then 2 days later, we had 28,000 users. And we were streaming data continuously until we actually shut down the University of Houston servers. But what you can see is you can see the data looks just like the beautiful, beautiful, beautiful data that come out of this. So what an opportunity for delivering scalable anti-sedentariness approaches, behavior, technologies, and so on. And it's not just about activity, it's about food too, as you just heard. This is where you take pictures of your food and other people can comment on it. This is my food, and that is not a stool, it's actually a little chocolate bar. And it's great. It's amazing what people will say about your food. Jim, are you eating that again? Jim, do you never eat healthy? You know, and so on and so on and so forth. I do my best. And so this, interestingly, was ultimately sold to developed in collaboration with the University of Newcastle, was sold to a social networking company, and it looks better and more professional than it did when we were doing it. Integrating into the cell phone platforms, there's a lot written about this. We've written a paper about this and so on and so forth. Others have far better than I. Yeah. So the real opportunities, these technologies are providing us real opportunities for personal change, and there are multiple platforms, huge chance. We've also got to move the culture. Yes, Matt, is that Matt Dillon? I can't, no, it's Damon. What's his name? Yeah. Thanks to him, obviously, for wearing the Armani suit, which is the neat suit. So the idea is to create a culture of movement. This is a business suit that is lighter than a Nike tracksuit and can be worn at business meetings and out on the road. I know the media get it wrong from time to time, but unless we're going to work with them, they're not going to get it right. So Dr. Oz went neat, thanks to Dr. Oz, but it took a lot of time and nurturing to get the message. And when he issued the message, how beautifully it was written. These are professional communicators. And so, ladies and gentlemen, thank you so much for inviting me. I'd like to conclude. This is kind of how our approach has been, is to taking this sort of scientific foundation and bringing it out into reality. And basically what you can see is that we have a multi-line approach. We attack science, we do policy, we do clothing, education, and so on and so forth. And I think if we do this as a collective, we have a real opportunity to get America up and moving. And there's a real opportunity, as you've heard today, to reverse sedentariness and the ill health associated with it. Now, I was going to stop right there because enough is enough, but I literally, while I was at the back of the room, I got this email, and this came off the Mayo Clinic server, and I literally got it this morning, so I'm going to read it out to you. This is from a person on the internet, and I've changed her name. Hello, Dr. Levine. My name is Vanessa, and I am 51 years old. I am so tired of sitting all day, which I do between 10 to 12 hours, exclamation mark. Since working with my company at age 25, I've gained over 60 pounds, all in the midsection and butt, of course, exclamation mark. The body isn't, this is her words, the body is not made for sitting, and it is the cause of many diseases. I hope this email makes its way to you, and I really hope to hear from you. Ladies and gentlemen, thank you so much.